For pregnancy, there are a lot of risks in pregnancy, but I can name few. Like if you are pregnant, the main thing with pregnancy, the first thing, fever. And fever should not be with a pregnant woman. If you have any sign of a fever, you need to go to the hospital. Because if fever is there, maybe it could be malaria. Maybe it could be something that has triggered it, that you have the fever, that is another infection. We also have another danger sign is swelling of the feet, we call edema. Some of them, when the feet are swelled, they said, we are going to deliver a baby boy. And we said, no, that is traditional belief. For us, when you have edema, you need to go to the hospital. Maybe it indicates you are having a high blood pressure, or maybe it's because of excess intake of sodium that can cause that.
Whenever you see the feet are very filled with fluid, which is edema, you must come to the facility for immediate care. Preeclampsia, this, which is we have the preeclampsia, we have the eclampsia, we have severe eclampsia. Yeah, preeclampsia is an hypertensive induced pregnancy that is stretched to life, that can lead to the death of a woman or both the mother and the baby. This is what we mean by the word preeclampsia. Talking about headache, consistent headache, heartburn that is very persistent. Sometimes when they have heartburn, they will say this is peptic ulcer. These are signs of eclampsia. When they have heartburn, they must be very careful of it. And also dizziness, they must be careful of it. And a fever as well. And some signs of fainting.
Have convulsion, because if the blood pressure is high and you have edema, it can lead to convulsion. So we advise them it's a danger sign for pregnant women.
These are danger signs because these are signs of eclampsia in pregnancy.
We also advise them on bleeding. Some of them, when they are pregnant before 3 to 4 months, 5 months, they sometimes experience bleeding. Maybe during sex, maybe not even during sex. Some of them, when they lift heavy objects, they will see some bleeding. And we refer them to the hospital because we have different way of this thing. Maybe it's due to the position of the placenta that can cause the bleeding. So we refer them. If you see a bleeding and the pregnancy is not term, you go to the hospital. And we also have weakness. Some of them, they will be persistent weak, vomiting. You will have some, from the starting of the pregnancy until delivery, they will be vomiting throughout the pregnancy. We advise them to go to the hospital because if you lose more fluid, the baby would be at risk also. So these are some of the danger signs we talk about here and teach them to follow and go to the hospital.
If they have those signs, they should not wait. They should come immediately to the hospital and go to the nearest facility that is very close to them so that they can be referred to a CMOC facility so that they can have a comprehensive and holistic care.